It just take a few more seconds. It's preparing. So when I see it's working, I'll introduce you. That way we'll know.
That's good.
So wait. Okay, perfect. Okay. Hey, everybody. I'd like to welcome you to our Facebook Live, and it's great everybody could be here. As you know, we do Facebook Live typically on Thursdays, and I'll be back on Thursday. But today we're having a real special event, and it's really an honor for me to share with you. One of the things we speak about a lot is AI, and where AI is going, and everyone has lots of questions, some of which we can answer, some of which we can't answer. But there's so much going on, and we really have the privilege, this is the first time, of Prerna Dogra, who's part of NVIDIA, part of the medical side of things, really sharing with us sort of what NVIDIA is doing. Now, we could be on this call for about 3 weeks if you want to know everything NVIDIA is doing. But NVIDIA had their annual or biannual meeting last week. There are a lot of cool things that came out of the meeting. You can watch them. We've posted a lot of things online, but now we're going to hear it up close and personal. And Prerna is going to talk about some of the things they're doing, and then we'll have an opportunity to ask questions. So with that, I'll turn it over to you, and you can share your screen or whatever else you need to do.
Awesome. Thank you. Thank you, Dr. Fishman. And first things first, I'm incredibly excited to have this opportunity to interact with this community. And let me go ahead and share my screen. The Dr. Fishman, it says the host disabled participant screen sharing.
Okay, here, I'm fixing it.
Sure.
Okay, now you're fine.
Awesome. Yep. Hopefully everyone can see my screen.
Yep.
Cool, great. Yeah, so I mean, today I'm going to be here, and I'm looking forward to the conversations we'll all have around how do we really push the frontiers of research to have clinical impact with AI in radiology. And a quick introduction on myself. I'm Prerna Dogra. I'm a senior product management here at NVIDIA, and I'm essentially responsible for building computational platform and tools for researchers and developers. And I'm essentially responsible for building so their work can be accelerated. And today, really, I think the pieces that I really want to engage with this community on are how can we not just accelerate the frontiers of research, but also have clinical impact. Also learn from you guys as to what is it that's really budding and engaging in this great community of CTisus. And with that, let's get started. So sort of taking a step back, right? I don't think anybody questions this, but in the notion of that the era for artificial intelligence in healthcare is here, sort of taking a look at the holistic big picture, like how does this all work, is on the left-hand side, you have these, you have plethora of digital data being generated by these endpoints, right? And you take all this data and we are training AI models. And these AI models are, I'm calling them skills over here, but essentially they are taking, you're turning data into skills. And these skills are domain specialized for medical imaging. And when you take these skills and then deploy it, the deployment of these skills is completely different from the deployment of the past, right? Some of these skills will live in instruments. Some of these would be behind hospital walls. Some of these would be probably hosted from the cloud. But the reality is that when smart hospitals or instruments and all of this that we talk about in medical imaging or healthcare will all be powered by AI, it would actually be invisible. The AI element would completely be invisible, and it would just essentially be bringing efficiency to different parts of the workflow. So in that sense, AI is really that skill or a tool that you can build and apply to a given problem. And while there is no question that the promise that AI holds for healthcare overall, but staying more focused on radiology, the promise for radiology is immense, right? 30% of world's data is in healthcare, and 90% of that data is in medical imaging. So I've sort of just called out a couple of use cases here, and Dr. Fishman, you potentially are well versed with these, especially in the space of CT. AI can have an impact right from the CT acquisition acceleration to reconstruction to having specific tasks visualized in a CT pipeline, and then obviously driving all the way to clinical decision support, right? So there are cases, we have startups like Subtle Medical, who have essentially reduced that acquisition time and lowered the cost of care with deep learning by essentially having this deep learning model that enhances the image quality at the time of acquisition itself. There are cases where the Ohio State University researchers essentially build AI models that could support radiologists in clinical decision support. When there's a brain stroke, time is mission critical because every minute that the stroke goes untreated, a patient could be losing anywhere to 2 million neurons. And with that kind of an impact, the OSU researchers essentially use deep learning to help clinicians have this yet another data point as to which patients are more critical than others. Another use case could be from Mayo, where again, the researchers and the clinicians collaborated, and essentially they were able to get these insights about genetic data from MRI images, which eventually basically greatly reduced the need for having brain biopsies every time. So these are some applications like for where AI has sort of enhanced different parts of the workflow. But if we think about it, the applications are endless, right? I think the crucial piece is to stick to the fact that there must be a clinical impact with these applications, which brings us to the fact that, AI should not be treated as a hammer. And more often than not, we do. Like, I think with a lot of buzz around AI, sometimes, the solution to a problem is called like artificial intelligence would solve it. But that's not true. Artificial intelligence, whether it's deep learning, machine learning, or any sort of learning, is just yet another tool that can be applied to a problem, but the problem and the workflows have to still be very much driven from the domain. So in our humble opinion, in radiology, in medicine, in diagnostic imaging, AI cannot be treated as a black box. There are use cases, there is value for it being a black box when the cost or the price you pay for a wrong answer is not very high, or it may even inspire new ideas. But in case of radiology, you really need a foundation of a collaborative loop between a team of clinicians and a team of researchers, because this sort of really goes hand in hand. And when I say collaboration, I don't mean a case where certain clinicians or experts are annotating images ahead of time, and then the researchers go into their cave for 2-3 months to build an AI model before they come out and get their results evaluated. I mean a continuous conversation, a continuous collaborative loop, so that expert annotations, clinical evaluations, clinical guidance is actually iteratively guiding the process on the researcher side for what are the model architectures, how should they be tuning their loss functions, how should they be applying optimized transformations to incorporate some of that clinical guidance. And we did really want to test this model, right? And last year, we were incredibly proud of the work we had with the NIH, like with the COVID-19 pandemic. We really wanted to see how NVIDIA can contribute. And as the builders of the AI computational platform of the world, we collaborated with the clinicians at the NIH. So the clinical team at NIH collaborated with NVIDIA's applied research team to build these AI models for essentially chest CT classification. And while the impact when something like this comes through is huge, because now you have these chest CT classification giving you results in seconds versus hours or days, whether there is COVID or not, or what is the potential or the prognosis of the disease. More critically, this work was co-developed in a period of less than 4 weeks, with thousands of diverse images collected from China, Japan, Italy, US, expertly labeled by NIH radiologists and sort of co-developed with the researchers in less than 4 weeks. And this could only be possible because the clinical teams and the research teams were on the common tool set, right? That is what is Clara Imaging Framework. So Clara imaging has been NVIDIA's contribution in this space. And putting it simply, it's essentially a bag of tools that developers and researchers use, tools that give them a leverage in having their breakthroughs faster, building their applications faster, and giving that hook into a clinical workflow as well. So we provide pre-trained models. There are capabilities for being able to do AI-assisted annotation with other open source viewers. There's a training framework to take this annotated data and turn it into an AI model. And then a deployment framework where you can take these AI models, build applications around them, and deploy them in real hospital infrastructure. However, this is still not enough, right? So, and I'll get to that in a bit. There is, even though we had made our contribution with Clara imaging, we realized that there is a need to actually join forces, because one element of this collaboration is that the tools being really robust and the quality of the tools. But the other element is also about bringing the ecosystem and collaborating with the ecosystem as you are building the tools. And so as we were reaching out to the likes of King's College London or Harvard and MGB and Imperial College London, we learned that everybody had their own tools. And it's not very efficient to have these disparate tools which don't actually talk to each other and are actually making the life or decision making for researchers and developers, a community that we all want to nurture, harder. So there was this really big need to actually join forces, because like I share on this slide, there are too many options of software tools that don't talk to each other, but the development problem that they're all trying to solve is the same. This fundamental need was the founding of what is called MONAI, right? So MONAI stands for the Medical Open Network for AI. It was really incubated in MICAI of 2019 and essentially started as conversations between industry and academic partners. So Project MONAI is this open source initiative built by academic and industry leaders. NVIDIA and King's College London are the founding members, with the goal of really standardizing the best practices for deep learning in healthcare imaging and really pushing towards that goal of reproducible science, because research and science can only go as fast as what's the reproducible factor for the rest of the community to be able to get those results, leverage it, adopt them for other downstream tasks or applications. So that is sort of the soul of what we initiated with our academic research partners in MONAI. And today, so in the last 20 months since its first release, MONAI has really grown in leaps and bounds, right? So again, just like Clara, think of MONAI as a bag of tools. And there are tools in there for labeling and allowing the researcher and the clinician to collaborate and have this notion of an AI-assisted annotation, which I'll jump in a little bit. There are tools again for training that deep learning model. There are tools to take a model and turn it into an application so that it can talk DICOM and it can talk FHIR and it can just seamlessly fit into the clinical workflow, because you are not going to expect clinicians to come into the labs of researchers to evaluate results of an AI model. These insights, this input from research and the insights from the clinical team have to seamlessly be embedded in their existing tool chain. So MONAI Deploy App SDK makes it really easy to build that sort of an application that can be deployed in a hospital-like infrastructure. And like I said, as you can see, the number of partners who are contributing to MONAI has grown from King's College London to NVIDIA to Kitware to Stanford, DKFC. We now have the NCI team joining MONAI, Warwick University, Vanderbilt University. So a huge shout out to all these collaborators. And so sort of now getting into a little bit about what is inside these tools, right? So we always start the journey of AI with data. And it's a well-known fact that your data determines how good your AI is. So your AI can only be as good as the quality of your annotated data. And the challenge there with specifically in medical imaging is that creating high quality annotations is hard. And I'm sure Dr. Fishman, you can vouch for that. It's time consuming, and there's a lot of heterogeneity in the quality of annotations that do get produced. So what we did with our first tool in MONAI Label is essentially gave the underlying plumbing and an infrastructure so that researchers could easily plug in their AI models into a viewer. We have support for 3D Slicer and OHIF. So we have support for something if you want to download or if it's a zero footprint client. So you can essentially, researchers can plug it into a viewer and clinicians can interact with the viewer in a user interface. So never getting into worlds of Python that they don't need to, and evaluate how the AI is performing for certain annotations, make corrections with their manual tools or other tools to those annotations. But right there on the viewer, there would be a button that after you have made those corrections, you can hit a train button and say, the model should now adapt to this new insight that the radiologist or the clinician gave from the other end. We took this tool that we had built into the community. And one of our first adopters was the work from Children's Hospital of Philadelphia, Dr. Matt Jolly and his team, right? So they've been developing AI models for segmentation of the heart valves in 3D echocardiographic images with patients with hypoplastic left heart syndrome. And they already had the model developed by their researchers. But what does it mean for now Dr. Matt Jolly to give his clinical inputs to how the model is performing? And a lot of researchers, a lot of academic centers are doing this, and everybody's building their in-house tools. But it's a little bit like reinventing the wheel if you're doing that. That is why we built Monai Label as the standard paradigm that can adapt to any model and sort of gives you this extremely easy way to establish this integration with a viewer baked in for the clinician to be part of that process of building AI models. You can learn a lot more about Dr. Jolly and his team on the CHOP Edu website. They also have a GitHub link, and they've really championed the use case with Monai Label. And they'll essentially take this model and now are ready for a hospital-wide deployment so that not just Dr. Jolly, but other clinical colleagues can also interact with the model, can also not just in words give feedback, but actually correct the annotations from a model and right there, hit a button to train the model so that it learns from that corrected annotation from the domain expert. That's the work we are doing with Monai Label. And again, King's College London has been our development partner. Within King's College London, the clinicians and researchers are using Monai Label for their collaborative experience as well. Once you have the labeled data, that's when it really gets into the meat of building that AI model. And I wouldn't get into the technical details of every section of this workflow, but at a very high level, once you have that data, especially in medical imaging, it's very important to augment the data in a very rich fashion because we don't have the liberty that other computer vision fields have of just having a huge amount of data, right? So we need to have rich set of augmentations so the network can actually see a wide variety of data, even though it's derived from augmentations applied to the same image in that sense. The work done in transformations in Monai is very, very rich. And I am very proud to say that it's actually the best that exists in terms of the transformations that Monai supports for medical imaging. Once you've augmented the data, you obviously have the data sets and the data loaders, which need to download this data and extract it and make it ready for training. And then comes the researcher expertise of defining the loss function and fine-tuning it and defining the training parameters, the evaluation functions, visualizing the results and iteratively looping through it unless they think they have a highly optimized model. The most important thing about Monai and the way it functions in this model is not what's technically inside each of the box, but the fact that no one company or no one institution defines what should be inside this box, right? Monai completely functions as this network of thought leaders, and we have working groups established for imaging IO, for data, for transformations, for federated learning, for pathology. And it is in these working groups, the discussions that are driven by the working group leads, but the community that they bring with them, a community of researchers, a community of academic professors, a community of clinicians who actually join these working groups to guide what are the capabilities that should sit foundationally, that should be supported foundationally to really realize this dream of having an open ecosystem of these reusable tools. So a lot of what goes into Monai's development pipelines is actually guided from these amazing working groups. Once you have that trained model, you get into the deployment. Like I said, Monai Deploy aims to become that de facto standard of developing, testing, and running medical AI applications in clinical production. And today where we are is in clinical evaluation. But that's huge too, right? Because a lot of time, like I'll give an example with King's College London, there's immense momentum behind the research that happens there. I'm sure that's true for Johns Hopkins, where there are so many publications that are coming out of the research and the applied research teams. But not all of them can even be quickly evaluated for clinical evidence or clinical studies or clinical trials, even through the IRB processes, purely for the lack of standardized infrastructures. And again, if we all go and build their own, we are sort of reinventing the wheel. So King's College London and their consortium with the NHS fund for the AI Center for Development is building that platform across NHS in the UK that would be going across 18 hospitals for deployment using Monai Deploy. And that's a huge feat to say, yes, AI is getting closer to the clinic, and the momentum that we are seeing in this increase of the PubMed publications of applications of deep learning and machine learning in radiology will find their way into clinical evaluations. So extremely excited about Monai Deploy. And this is where the whole part of AI comes into the workflow of medical imaging or radiology, where your application now needs to be able to talk DICOM and FHIR and seamlessly engage in the existing workflows. So with that was sort of our effort, our initiative, our life's worth of work that we've been focused on for the last 1.5 years, 18 months, and that's not a long time. But Monai's momentum has been growing exponentially, right? As you can see, we are at 150,000 cumulative downloads in this period. Our ecosystem of partners, contributors, which means people who are putting their time and effort into contributing into Monai. Because like I said, Monai does not belong to any one company or any one academic medical center. It really belongs to this community of medical imaging researchers and clinicians to drive what would it take to make this promise of AI realized. And if it's already realized, have it realized at an accelerated pace. So we're incredibly excited seeing the stickiness and the exponential growth that Monai is seeing. And it's also getting integrated, which is phenomenal, because now it's accessible through all the cloud providers. There are AWS, Amazon SageMaker notebooks, Azure Machine Learning, the Google platform building on Monai label to stand up a service. It's integrated into enterprise MLOps, into other, like I said, open source viewers like OHIF and 3D Slicer. And there are solutions deployment also available for hospitals. And this is, again, that shows that Monai is now with something that started as this, I still remember that day on MICAI 2019, something that really started at this humble conversation over a lunch briefing with a bunch of academic professors and the community joining forces, has truly become a force to reckon with, is truly finding its way into all these integrations, which would just bring more scale, more awareness, more education with the open tools and capabilities of Monai. And sort of bringing it back to Clara, I'm incredibly proud to say that NVIDIA is actually the enterprise engineering team backing Monai 100% as this open source community-led project. Everything that we are doing in Clara imaging for the AI-assisted annotation, for all the pre-trained models that we are building, our training framework, the capabilities that it has for AutoML or self-supervised learning in the future, the deployment engines are all built through Monai. So NVIDIA is really behind it. We're really committed to it. And we do want to engage with the community to build and nurture the ecosystem. And yeah, I did want to share with you some of the breakthroughs that have happened recently in medical imaging. And more than like what is in the breakthroughs, it's essential to understand that it's actually the tools that drive that efficiency and acceleration for these breakthroughs to happen at a faster pace. And not just for the breakthroughs to happen, but also for them to find their place in clinical use cases, in downstream applications. So vision transformers are really picking up. They are well established for transformers for NLP tasks, but they're really picking up in computer vision as well for image classification. And at MICAI this year, we had the first state-of-the-art UNITAR network architecture, which was leveraging a vision transformer built by NVIDIA and Vanderbilt. Again, all made available to the community in open source through Monai. There were 3 submissions from NVIDIA for the BRATS challenge, and the ones that were ranked number 1, 7, and 10 were all using Monai. There's amazing work that's happening from DKFC with their NN detection toolkit. Also, again, trying to push that frontier of research with reusable tools. Similarly, the work coming out of Peking University for graph neural networks for registration. And then finally, there's really been the work that happened last year with NVIDIA, MGB, and 20 collaborators across the globe in bringing multimodal federated learning to a real world use case. And this is actually this sort of really takes it home, right? Because federated learning is one of those things that really started in research incubation, and it was in simulations and it was in publications. But as someone like NVIDIA and our academic partners put their weight behind it, I think with the COVID crisis, it became imminent that if there is room and if there is place for federated learning, the time for it is now. And so we wanted to test the technology in real world. And for that, there was this multimodal model picked up from MGB, in a distributed fashion, trained across 20 global sites from Japan, from India, from China, from Brazil. And the aggregated model, the global model, was reshared with all these sites. And the results were stellar, because everything that federated learning promised on research publications was true when put to real test. That is that every locally trained model was outperformed by this global model by a significant margin. And that really shows the promise of federated learning to build more generalizable AI models. So this one really is a case of taking it all the way from research incubation to real world. And hopefully in the years to come, we will see federated learning becoming the de facto standard for learning or developing AI, especially in healthcare settings where data is just so private by nature. But yeah, that is all the context and stuff that I wanted to share with you guys in terms of what is it that we've been doing at NVIDIA, how we are contributing. And I find it so phenomenally amazing, Dr. Fishman, that the community that you've built with CTisus is actually in the same spirit, that you want to have a community of like-minded people coming together to discuss, to solve the real challenges.
That was fantastic. So I'll leave the federated learning out for a second, because I think that's very important. Maybe we'll ask that as the last question, because we've been involved with NVIDIA and Rhino Health on a multi-site project for early detection of pancreatic cancer, 9 institutions using federated learning as a way of being able to test and share data without any of the typical problems of, and IRBs are beginning to accept it because they're first understanding it. So I think that's very exciting. But sticking with Monai, I guess just for the audience, people can ask questions, and this is a good time to get them answered. But, how is it, if you're a site, whether you're Hopkins or anybody online in Europe and Asia, all the people, Australia, how do you get started? How do you participate in Monai?
Yeah, absolutely. So when we say that it's open source, that means Monai, the code and the community is all driven on GitHub. So it depends who you are. So if you are a developer, a researcher who wants to use Monai, contribute Monai, the place to get started is GitHub on the Monai channel. We also have a website called monai.io and a very dedicated get started page. that can walk you through tutorials. We've done boot camps to get you onboarded. We have a very, very active development team that has a turnaround of 24 hours if you bring up questions on GitHub issues. So if you're a developer, researcher, I would say get started with GitHub, and there's rich content and tutorials as to how to get started. On the other hand, if you are a clinician, if you are a consortium or a team of like Dr. Matt Jolly from CHOP, right? A team of clinicians and researchers, or if you're a researcher who wants, or a clinician who wants to get started on a specific working group, again, it's all captured in our website, monai.io, in our working groups. And you can, all our working group calls are open. The minutes are published on the GitHub wiki, and you could just send an email to myself or to any of our working group leads to essentially say, I would like to join the transformations working group and learn what are you guys talking about there. Or I would like to see what's happening in Dr. Rajput's pathology working group. So it's really a community, a conversation that we're having here.
So how much, it's always the question, if you're a clinician, you don't really have the computer skills. So the best thing to do is like find someone who has some computer skills to basically work with you. It's not like Elliot Fishman's going to go sit there and start programming. It takes a little,
exactly.
It takes a little more than that. I guess I have a couple of questions. So this is from Mahesh, who's at Hopkins. How is NVIDIA addressing AI tools to be free of bias? As many articles have had issues with bias or unintentional bias in AI. What things do you do to help prevent that?
Yeah, so thanks, Mahesh. That's an excellent question. I don't think I would have the answer of what we are doing overall as NVIDIA for everything to address the issue of bias. I am aware of the initiatives and the controls and the checkpoints that we have internally within the company as we are putting out pre-trained models or building these AI models. But one of the initiatives that we are taking from a Monai standpoint, or even the Clara standpoint, specifically because the space of medical imaging, the price of bias is also as high, is this notion of Monai open data sets. So we are saying that as we put out pre-trained models and as we put out pre-trained weights, we will also start building a repository of open data sets with labels available so that anybody can go in and see and has that traceability of what was the variation of the data that was used to train certain AI models. That doesn't necessarily address the only factor in the building of those biases, but that is one of the steps we are taking forward. I'm happy to connect you with someone at NVIDIA to learn more as to what are we doing at the scale of NVIDIA.
And going back to, you showed that nice work from University of Pennsylvania. So one of the biggest challenges, and you mentioned that I know, and I do know firsthand, we've labeled by hand 7,000 pancreatic masses and stuff and some normals. It just takes forever. We haven't really sped it up. So under Monai, the ability to use, whether it's your own custom app or some of the things off the shelf like 3D Slicer. So you found that to be very helpful for being able to segment data and be able to do that in terms of imaging?
Yeah, so what we found in our experience is that if you just have an app where you have let's say I even convinced Dr. Fishman to use our app and see what the AI predicts. It doesn't add much value unless you can actually do something with what the AI predicted. So I think that's what was the stickiness with the Children's Hospital of Philadelphia as well, that it was not just that AI predicted an answer and the radiologist was like, oh, that was horrible, or that was wrong, or that was right. It was that the clinician has the ability to now be in the loop. So if it was wrong, you can discard it, correct it, but there itself, now there is a button on that UI of 3D Slicer or of OHIF that says train. And while Dr. Fishman is not writing Python code, at that click of a button of train, you are training the model. You are adapting it to the corrections that you just made to the annotations. And I think that is the sticky point with Monai label.
And I know we're running out of time, but I guess you mentioned federated learning, and most people don't know what federated learning is. In fact, I've kind of learned the hard way that most of the organizations from the NIH down who grant, since federated learning is so new, whether it's on IRBs or it's people who give out the grant money, federated learning sounds like they don't know what it is. And so they kind of worry about it. Again, federated learning. So why don't you explain just in this for the simple terms? I mean, obviously from clinicians, everyone in the audience knows that one of the hardest challenges is it's hard enough to use your own data, but if I want to use data from Mass General or from Stanford or a hospital across town, it becomes very hard because everyone's afraid of a HIPAA violation. That's the biggest scare. So how does federated learning prevent that issue,
Yeah, no, absolutely. Excellent question. Thanks, Dr. Fishman, for asking that. So like you said, right, we're saying on one hand, we say that 90% or 30% of world's data is healthcare data, and this is the potential of AI in healthcare data. The reality is that data is under lock, and data is private by nature with HIPAA and other regulatory compliances, and rightly so. So how do you then tap into this potential of data? It's not possible to create a centralized repository every time. So federated learning is this distributed computing paradigm. What that means is, with this technology, I can create a network of distributed nodes. So one could be Johns Hopkins, another one could be MGB, one could be Stanford, another one in India, Brazil. Connect them over the internet, and have each of them train a common model for, let's say, pancreatic cancer detection. So all these sites would locally train the model on pancreatic cancer detection with their data never leaving the site. So your data never crosses the firewall of your hospital or wherever it is. Once you train that local model, you can then share back. And there are different ways, and this is a very, very hot topic, even in research field, as to what are the ways of sharing model weights in a privacy preserving fashion. But you can basically share back the learnings, not the data, the learnings from the data, so they can be aggregated computationally. And what federated learning is really promising is generalizability, right? So even to the earlier question of bias or having, in a way, sometimes your models overfit to only a certain population or certain data sets, federated learning can be a tool as we think through that holistically to say, how do you build more generalizable AI models that have learned from diverse data sources in a secure fashion without data privacy being compromised, and have this aggregated global model. And because this model has learned from, has the learnings accumulated from all these other sources, it actually outperforms every locally trained model in our work and in studies that we've done so far.
Right, so really very successful. And just for the audience, I know we don't have the time to go through federated learning in detail, but it's very, everyone is interested in it. Now I got a note, I was participated, NVIDIA had their biannual meeting last weekend. I was in a federated learning talk. I didn't have a lot to say. I wasn't smart enough, but whatever I did say, but I know that was I was told that was the 5th highest rated talk of the entire meeting. And there's hundreds of talks, and there is going to be a talk at RSNA. So radiologists, you'll be at RSNA most likely remotely in 2 weeks or so, but there's some talks on federated learning there. There's also, I think, a number of talks from NVIDIA at RSNA on MONAI as well. You're probably talking there. And I know Prerna said that she will come back after RSNA and kind of fill us in on some more stuff, and people can read about it. We posted online that Project MONAI, MONAI.io, so you can go there and read about it. And I think when people read about it, a little better understanding, and we're able to ask more questions. But I think it's really, it's outstanding work. I know NVIDIA has been a big force in, connecting the forces in England and the forces in the US to kind of put this all together. But I think it surely speeds up delivery of products and projects, I think, which makes it very exciting. And then on top of that, you use federated learning to connect everything. And so the ability to really, work with other institutions. I think, like pancreatic cancer is what we do, our focus, and you're trying to look at early cancers. Well, no one has thousands of cases, but if you get 9 institutions together that have multiple hospitals, you're going to have a lot of cases. And so you're going to be able to hopefully come up with programs and protocols and software that's going to be able to take advantage of that. So I think it's very exciting. It's a way of really moving forward really quickly. I think all of us are really excited, I think, about the work, that you guys are doing at NVIDIA, so I have a bias of NVIDIA, but I think it's amazing, the work that's going on and how rapid the changes. I think one of the things I think all of us recognize by your talk today, and what you read in the paper, I mean, you cannot read a newspaper without an article on the front page about AI. Now, not every article is positive because there's always a concern, but I mean, AI is changing the world. I mean, if you go to RSNA this year, whatever company you look at, whether you're looking at scheduling software, whether you're looking at scanners, whether you're looking at dictating, whatever you look at, everybody is building AI. And I'm sure every sign, when you go to the restaurant, they'll be using AI. You have to use AI to figure what you want to eat for lunch. You just can't say, give me a tuna fish. AI will tell you this today, maybe you should get the turkey, not the tuna. But in all seriousness, I think it's very exciting. I think it's whether you're in CT or MR, whether you're in cancer or you're in internal medicine or you're in oncology, whatever you're doing, I think this really gives us great opportunity. So I do appreciate you sharing. And again, if people have questions, I know as typical, about 90% more of our people will be listening to this today, tomorrow, or over the next week. So if you when you do it, we're not going to be live with you, but if you ask questions, I'll do my best to answer them, which means I'm just going to send them to Prerna, and she's going to answer them. But so if you have questions when you hear this and you regret not being here live, just write the questions down and we'll do our best to answer them. So with that, have a great day, and let's get back together. We'll figure out a good time after RSNA, and we'll do part 2. Okay.
Sounds great. Thank you, Dr. Fishman. Again.
Thank you very much, and everybody, have a great day. See you later.
Have a great day. Bye-bye.